Hi, this is Mary. I'm with ZuLoo. We're here with one of our friends that's received one of our toilets, and we're just going to ask her how it is, how some questions, and how her life has changed and benefited since then.
Having the toilet at home, it was difficult. I had to take children, my daughter. There's a daughter, so she had to take her and go. It was very difficult, but after receiving the toilet, I'm very happy, and it is comfortable.
Good. Yes. We're so happy. We're so grateful.
Welcome to the ZuLoo Poodcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humour, we aim to discuss and highlight the critical role toilets play in flushing poop out of our lives, the impact toilets have, or lack thereof, on the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
This episode of the ZuLoo Poodcast is sponsored by ZuLoo Humanitarian, a non-profit organization committed to delivering sustainable sanitation, clean water, and hygiene solutions to underserved communities around the globe. Head to zuloo.org to learn more.
Her name is Sudha Rani. She has 3 kids, 9, 7 and 5. So early morning, like she has to get up and take them. And it is very difficult for her because she has to prepare them to take them to the school also. She says she can't go alone early morning. At least they make a group of 2 to 3 people and then go. And it's very far. She says it is not anywhere close by. They have to go far. And suppose if they take the children and make them squat somewhere, the people don't agree for that. So what she says is, I'm saying, suppose we give bathroom, how is it going to be useful for you? So she says there will be a lot of time saving, that I should go once and come back, then I should take my kids and come back. And she says we can have a bathroom at home, so all this time will be saved. And she says she can engage in some kind of income generating this thing. She can work. When they go there, if somebody is there, so it will take a lot of time for them, and they will be late to their work. So, even the employers also will like scold them, and they reduce their wages and all that. Sometimes, many times, they also remove them from the work. Because always you are coming late, so you better stay back at home. Her name is Sunita, and she has got one daughter. Any samachar? 11 years old daughter, adolescent daughter, and she feels very shy to take a bottle and go. And sometimes they go in the night, but there are snakes around, snakes and insects around. So she feels very shy, now as she's growing, because she's 11 years. So she feels very shy, and even all her friends also who have their bathroom, like make fun of her, like you need to hold a bottle and go that far. At night we are very scared because of the insects and snakes and boys abuse, and also she says for that it is affecting my wages also.
My name is Sujata.
She says she has a 11-year-old daughter, and she says we have only one room. If there's a toilet, it will be like a shower come this thing, and it is easy for my daughter to change the clothes. So within the house, like you have to shut your door and change the clothes. That also is an issue. So if there is a washroom, she can take her clothes and change and all. And when they go out, when like they wear like this. So to open and sit to squat. So people will see at them and laugh and all. So the children are feeling very, very nasty about it, because they have to open that. Like, you have to remove, and there will be a thread where you have to remove and sit. It is not elastic. So if we have a bathroom, it is not only for
Tension, no tension.
toilet.
బట్టలు మార్చుకొని ఈజీగా వచ్చేయచ్చు.
So you can change clothes also. My daughter can change clothes. We can use, and in the night when we go, there are snakes around. So all these are issues, not one. She says several issues.
Yeah.
her name is Mutyalamma. She's 60 plus years, and her husband is 65 years. So for her, 60 means senior citizen. She says like she has to walk, so kaal neppula. So she says her knee pains and all because she has to walk down and all that. Her husband doesn't work because he cannot walk and all that. So for him and for her, she says it is very important to have a bath. Her name is Mahalakshmi. She's a widow. She has only son, and her daughter is not at all keeping well. She's sick. She's sick, and she says most of the money goes for hospital. Of course, she's not revealing what sickness, so I don't want to really ask her also. She has two granddaughters who is 17 years and 11 years. She says actually she has a problem walking. She has a problem, but she is the one who takes them very far off, both the kids, both the granddaughters, and she accompanies them every day. I asked them how much time will it take for you to go and come back. She says half an hour to go and half an hour to come. That is when nobody is there. But in case somebody is there, they have to wait for them to go away. Then they go. So it may take more than 1 hour to go and come back. They say we cannot even follow one particular time also. Sometimes she says many times after they coming from the school, they go. So she says we cannot maintaining a time is not at all our option. So wherever there are people, less people, that time we have to use. She says that during menstruation, because she has a 17-year-old granddaughter, when we go there, because we go in 2-3 groups, because she has to change the sanitary pad or cloth also. So what they do is, we tie a sort of a cloth. We take a sari or something. We tie 2-3 people will hold, then they'll change. So even changing napkins also a problem because you do not have a bathroom. Her name is Paisamma. Full Paisal. Paisa means money. So she recently lost her husband. Just 1 month back she lost her husband. So now she's staying with a younger this thing, and she's not feeling well. So she says going that far, and usually in India they are very like sentimental. A widow cannot openly walk onto the streets and all that.
గాంధీ తీసుకెళ్ళి పోలుస్తామనేటప్పటికి చనిపోయాడు మా ఆయన.
She is talking about her husband, how like they already spent a lot of money for private hospital. They went to the government hospital, they exhausted the money. She said, I have a house, but we didn't even like move around the house. I lost my husband. He was a main bread earner, and she's been crying for days. So she says she cannot even see. She has an eye problem also, she cannot even see. So this is my situation, she says. Her name is Punyavati. Last time when we constructed, she was one of the monitor. So I will ask her how like last time people benefited and how they select the people now. Okay. So I'll ask them. Okay. So I asked her what is the criteria. Suppose if we are giving only 30, there are 40 people who are in need, how will you select them? So she says people with children, girl children and elderly people, we prioritize them.
Hey friends, it's Jocelyn with ZuLoo. I want to share something that's really stuck with me after doing this podcast for the past few years. I feel like I've lived these stories, listening to what so many women and families go through every single day. As a mom with 2 young daughters, it hits me on a completely different level. Imagine having to wake up before dawn and risk assault just to find a private place to go to the bathroom. For 673 million people, that's not hypothetical. That's daily life. And for so many girls, the lack of a safe, clean toilet means they drop out of school once they reach puberty. Just trying to manage something as basic as hygiene ends up costing them their education and their future. That's why ZuLoo Humanitarian is doing this work. building safe, sustainable toilets and clean water solutions for families who need them most. It's not just about sanitation. It's about dignity, safety, and giving girls a real chance. And here's the part that gets me. You can change that for a family. Just $350. That's less than $1 a day. You can fund a toilet for up to 7 people. If this speaks to you at all, please go to ZuLoo, spelled ZULOO.org/give. That's ZULOO.org/give. It really does make a difference.
Men also face problems because it is a road, people go around and move around. So, they go. But she says, my mothers and sisters, they are all my mothers and sisters. So, they are more problems. So, he is asking us first to prioritize the beneficiaries who have girl children. Most of the men are like patients and they are aged. So, for them to go that far and this thing, he says the men also suffer. So, mostly the aged, and most of the aged are like patients. Because they have a knee problem, they have a mobility problem, and they are mostly sick. I asked him, will you volunteer when the material? He said, confirmly I will do it. Oksar gattiga sappatlu kottandi Vinod Kumar ki.
Awesome, thank you. Thank you, sir. Thank you.
Hi, this is Mary. I'm with ZuLoo. We're here with one of our friends that's received one of our toilets, and we're just going to ask her how it is, some questions, and how her life has changed and benefited since then.
Before having the toilet at home, it was difficult. I had to take children, my daughter. There's a daughter. So she had to take her and go. It was very difficult. But after receiving the toilet, I'm very happy and it is comfortable.
Good. Yes. We're so happy. We're so grateful.
Hey, this is Darren Mangum with ZuLoo. We're here in Hyderabad, and we are here with, what's your name? Shanmugam.
Shanmugam.
Okay. And he's going to tell us about his new toilet by ZuLoo.
He says earlier before construction, before you all constructed the toilet, it was very difficult for me. I had to walk a few kilometers away from here. And going and coming, it was very tedious, and that's how I got my knee pain also because of that, going far. But now, with a door in the latrine in my house, it is very comfortable for me. I don't have to go far away. Now it is very, very good for me, and I'm very grateful to you all that you all have constructed a toilet for me.
Okay, thank you. Thank you for sharing. Thank you.
Hi, it's Mary with ZuLoo. I'm here with one of our friends that's received one of our toilets here. So I'm just going to ask her just a little bit of how she's benefited from it, how it's changed her life, and yeah.
So, Mama, this latrine belongs to her daughter. So before before we constructed the toilet, they have had lot of problems. But now my daughter is not here at home. She's gone for work. So on her behalf, I'm talking. That time it was a lot of problem. You can see tears in my eyes. But now we have everything. So it's good. I have another plot where I have another house. And that's where I stay because I'm all alone. I'm a widow. I have no one. So I'll be very grateful if you'll construct one more toilet for me and give. So she's so mama. So we have to see into the details, and then we have to construct the toilet for her. So that's what she's saying. So earlier it was a problem. She had to take because her son is there. That's her son who's small. So she had to take him and go for the nature's call. But now since we have a toilet at home, we are comfortable now. We don't have to worry even if we have diarrhea or anything. We all stay. We all have a toilet where we can use any part of the day. So she says.
Thank you. Hi, this is Mary with ZuLoo. I'm here with one of our friends that's received one of our toilets. And she's just going to tell us a little bit of how much it's benefited her life.
My name is Lalita.
She's saying, my name is Lalita, and earlier it was a problem for us. We have 4 of us staying. We have two families staying over here. So, and we have children. We have 3 children. So 2 belongs to my sister-in-law and 1 child of mine. So we had a problem that time, but now we are very happy that we have, because we don't have to carry our children and go for the nature's call. Now we are comfortable. We can leave. We can just close the compound gate and we can use the washroom, so that children are also safe now. So we don't have to worry. Children are no more getting infected, or so she's saying. And I'm very grateful and thank you to you all have given us this toilet. That's it. Thank you.
Thank you. We're so grateful.
This episode of the ZuLoo Poodcast has been sponsored by ZuLoo Humanitarian, advancing dignity, health, and opportunity through sanitation. Learn more at ZuLoo.org.
Thank you for listening to the ZuLoo Poodcast. Follow us on social media and visit ZuLoo.org to learn more about how ZuLoo is helping tackle the global sanitation crisis through toilets, clean water, and hygiene solutions. If you enjoyed the podcast, please subscribe, like, comment, and share. And if you'd like to support our mission, visit our website to learn how you can help change lives through better sanitation.